can touch, what they can smell, what they can hear, what they can taste. Sort of like tickly touch is actually really overstimulating, but in quite a painful way.
Right.
Environment, or keep being touched in that way, I'll get used to it.
Right.
No.
Hi and welcome to The Paradox of Change, a podcast dedicated to inspire people to talk. Today our resident therapist Lottie had the opportunity to invite Karen Prouton to talk with us, a therapist who's not just an advocate but a trailblazer in the realm of autism awareness. Karen challenges the conventional narratives, offering a fresh and insightful perspective on sensory assessments and support. She is dedicated, in short, to help those who feel disconnected find their voice and courage to speak out. Prepare to have your perceptions reshaped just a little as we delve into the world of being different. It's not just okay, it's celebrated. So I'd like to introduce you to Karen Prouton.
How you doing? Just
Okay.
just sink into it.
Not my comfort zone.
No, I
That's
can
all.
tell. I can tell. Just be with it. I'm really interested in all that you do. Okay, so we're talking about autism, and I believe that you are an expert in this field, which you will probably say, well, yeah, sort of. Yeah, exactly. So we're going to talk, but just let's have a conversation about it because I think it's so important. So where do you want to start? What made you get into the work that you're doing?
Well, I've sort of worked in the field of autism throughout my whole career, really. So I started off as an occupational therapist in the NHS, and I worked in a learning disabilities team for about 20 years.
Oh, wow.
And within that, we saw a lot of autistic clients, a lot of autistic service users. So I'd got a lot of experience there, and I did some training in sensory processing as well.
Right.
A lot of autistic people have some sensory hypersensitivities.
Okay.
So I sort of developed an interest there.
Yeah.
And then I sort of did a bit of a sidestep into an autism assessment service,
Right.
NHS Autism Assessment Service, as an assessor, as a senior practitioner.
Yeah.
So that really sort of cemented my knowledge and interest in autism. Alongside that, I've done my therapy training, my counselling training.
Yeah.
So alongside my work as an occupational therapist and then as an autism assessor, I've worked privately as a therapist. And it's kind of just been an organic thing, really, that my niche has kind of developed, and I can see why.
Yeah.
So I sort of advertised that I like to work with autistic people, and I've got that interest and that knowledge, and it's kind of grown from there, really. So I've ended up doing it for all of my job, so in the
Fantastic.
NHS and as a therapist.
Yeah. Yeah. And in private practice.
Yeah.
Okay.
Yeah.
And when we talk about the sensory side of it, what can you give us a little bit more of an idea what you mean by that?
Yeah. So a lot of autistic people find that they have some hypersensitivities to senses, so that what they can see, what they can touch, what they can smell, what they can hear, what they can taste.
Right. Okay.
And it's like the volume button's turned up
Right. Okay.
too much.
Yeah.
So that can cause a problem, say, in the workplace.
Yeah.
If they're somewhere where there's lots of noise, if they're particularly hypersensitive to noise, and different sounds, smells can be a problem.
All right. Okay.
And so there are ways of sort of working with that and finding out a little bit more about each person's sort of sensory preferences and sensory profiles,
Right.
to just be able to recommend what might help them
Yeah.
in the workplace, all areas of life, actually. If we think about relationships,
Yeah.
intimate relationships,
Yeah.
I've had clients who've said to me, I just can't bear being touched by my partner.
Right. Yeah.
And they get really upset. We don't understand why. And it might be that sort of like tickly touch is actually really overstimulating, but in quite a painful way.
Right. Okay.
So it can affect so many areas of somebody's life. And actually, when people come to me in both of my jobs, in sort of private practice and in the NHS, that's quite a big area for them, just not being able to tolerate certain environments.
Yeah. And the very small amount that I've read is then there's a behaviour that follows that. So if there's something that they can't tolerate, they're then going on to a behaviour. What would that look like?
So people can feel very overwhelmed.
Yeah.
And that's when their sort of flight, fight, freeze response comes in.
Right.
So you might have heard terms like sort of meltdown, shutdown.
Yeah.
And that's when people can just feel so overwhelmed.
Right. Okay.
That they just have to sort of get out of the environment. They can't sort of tolerate any demands being made of them.
Right. Okay.
And they might sort of just go into shutdown, not be able to speak, so they might become non-speaking.
Right. Okay.
It can look really different for different people.
Yeah, I think this is really important to know, and I'm really taking all this on board because it isn't just I don't like to be touched or I can't cope with that noise.
Yeah.
We're talking about the nervous system, aren't we? That actually gets a reactive process going. That actually I need to either go towards or definitely come away from.
Absolutely. Yes, I think that's something that I stress for people when I do some sensory processing assessments, which I do as part of my private practice, because I use some of what I've sort of developed as an occupational therapist. I say it's really important for the person to be able to understand themselves and communicate to other people that it's not just I don't like.
Yeah.
It's a real sort of they can't tolerate that particular stimuli, and it absolutely does affect the nervous system.
Right. Yeah.
So it's not something that they can sort of just sit and just get used to. That's something else that people say, well, if I just keep being with that thing or being in that environment or keep being touched in that way, I'll get used to it.
Right.
No,
they don't.
What will happen is you will keep being overstimulated and your nervous system will keep kicking in, and you will just be in a constant state of high arousal, high anxiety.
Right. Yeah. So continual triggering.
Absolutely. Yeah.
What do you think that because I feel like you did a workshop a couple of weeks ago.
Yes.
And it was amazing. Okay. And what do you think that you're teaching people when you're doing the workshop? Because it was interesting. The feedback was, I need more information when they got there. And when they left, it was like, I've got enough information to be able to now sit with somebody with autism. What do you think you're giving people when you are doing the workshop?
That's a really good question, because I think when I was designing that workshop, I thought, what do I want people to know in terms of how they relate to their autistic clients? And traditionally, what autism has been seen as is a kind of a list of deficits. It's in manuals of disorders.
Yes.
That's how it's diagnosed. So it tends to be can do, can't do, has difficulty with.
Yeah. Yes.
Which means that when we're sat opposite an autistic client, that might be what we have in mind.
Yeah.
A list of symptoms, if you like, or characteristics. And I really wanted to move away from that.
Right.
To actually sort of understanding what it means to be autistic. And I have to say, and I'm really clear with people, I'm not autistic myself, so I don't occupy that space.
Yeah.
I have neurodiversity in my family, but I don't occupy that space. So I'm sort of wanting to promote something that I don't have lived experience of, but I still think is really important. And that is that if we think about autism as a difference and a difference in the way that people experience the world and pay attention, that will help us understand the kind of the whole experience of the person that we're sat with. Rather than seeing their autism as a set of stereotype sort of differences, difficulties, like has difficulty with eye contact, can't cope with change, doesn't have empathy. That's another big misconception. So there's something called monotropism or monotropism, however you want to pronounce it. That's fairly new concept, and it's been developed by autistic people.
Right, okay.
And it's a sort of an explanation of how autistic people pay attention. And it kind of describes all of their experiences and characteristics.
Oh, that's amazing.
And it's very simple, really. It's just to say that the autistic person will tend to have sort of one attention channel at a time.
Right, okay.
And that attention channel can get really full and can feel quite overwhelmed if there's too much put into it.
Right, okay.
So it might explain why an autistic person really likes a kind of a deep dive into a particular passion or interest.
Yeah.
And they might want to know everything about it.
Yeah.
And then they might switch to something else and want to know everything about that.
Right, okay.
It might also explain why an autistic person has difficulty being flexible when plans change.
Yeah.
So there's that preference for sameness. So there's that one attention channel. They're expecting this to happen.
Yeah.
If it doesn't happen and there's kind of a roadblock, it's difficult for them to kind of flexibly change tack and move on to a different sort of option or a solution.
Yeah.
Whereas the non-autistic person might be able to do that quite readily.
Yeah. Yeah.
So, I'm very keen to, I suppose, challenge some of the misconceptions and some of the quite old ways of seeing autism. As not just a list of symptoms, but actually the characteristics can be explained by a difference in paying attention.
Yeah, yeah. And I love that concept that autistic people are giving the view of how actually autistic people are. And a couple of days ago, I Googled autism and it was so negative. It was the myths about it. It was the behaviour about it. It was very hard to find something. I think I had a big list here, but it was so negative. Myths, disinterested in social relationships, do not like to be touched. We touched on that. But it was all autistic people don't live a life. Repetitious behaviour, friendships and communication deficits. I wrote it all down, but I was thinking, Christ, I'm not going to bloody put that in it. It's terrible. I put like animals. That's what I put. It makes me realise how much I don't know.
Yeah.
Really don't know. Yeah. Yeah. So being able to do this podcast with you is really, really important, because I want us to get the message out that actually people like yourself are here to be able to help autistic people, but also trained practitioners within their therapy room to be able to either recognise it or be able to be with it so that we can actually learn to go, right, okay, what do you need from the therapist?
Yes.
Is that something that would be asked?
Yeah, absolutely. Yes. And I think quite often it's a case of helping the autistic person understand themselves and their experience of autism. Because I think I definitely agree with you that it can be a very sort of negative picture when you look online, when you look in some of the books. I think things have changed recently. But it's kind of a bit of a bleak picture, really, if you look in the wrong places.
Yeah.
So I think it's really about sort of being with the person. And there's a saying, if you meet one autistic person, you've met one autistic person. What does this mean for you, for the person that you're sat with?
Yeah, yeah.
And it might mean sort of going back and looking at when they were younger.
Yeah, okay.
Looking at their experiences when they were at school.
Yeah.
Maybe if they were not diagnosed when they were younger. Just actually, what does this mean for you, looking back on the younger self? As maybe sort of feeling like you didn't quite fit in. How can we help you sort of understand that in a different way? Yeah. How can we help you understand yourself now, and what do you need going forward?
Yeah, that's brilliant. Yeah, yeah. And how have you experienced adults that are now diagnosed with autism?
I think we call it sort of late diagnosis. So people who are sort of diagnosed, sort of well into adulthood. It really varies. So some people have said, gosh, what a relief.
Right.
I've always had, that people often say, I've always had a sense there's something.
Right, okay.
And there's relief that they're not odd or weird. And those are words that they've used, that they've been told.
Yeah.
I'm odd, I'm weird, I'm quirky. And there's relief that actually there's kind of an explanation.
Yeah. Yeah.
And they can sort of understand themselves. There's, as I said, there's sort of a lot of looking back over the sort of the years that they haven't been diagnosed. I think particularly for females, where they've really wanted to kind of fit in and have the relationships with their peers. But they've found that there's just a difference that they've never been able to kind of understand or explain. And so sort of looking back on that, I guess, more compassionately. And sort of understanding why that might be.
Well, I guess we know, don't we, from childhood and belonging, fitting in, being part of it, accepted, friendships, sort of social, how important that is. And to be in a world of autism, whether you recognise it or not as a child, you would have those feelings of feeling something wasn't quite right.
Just, yes. So many people say, I knew there was something different. And another thing that people often say is other people had a rule book.
Oh, right.
And I didn't get it.
Oh, wow.
There was a rule book for how children in the playground just knew that they were all going to play together, and they got the jokes.
Right.
And it was like, they'd got the understanding, but the autistic person hadn't, and they were sort of on the sidelines trying to work it out.
Well, waiting for the book to arrive.
Waiting for the book to arrive and not really understanding why they never got it.
That's such a strong metaphor, isn't it? Yeah. I can feel that when you just said that. Wow.
Yeah. And just sort of, on the outside looking in.
Yeah.
Really trying to work it out. And a lot of females have worked so hard at trying to understand, what do I need to do to fit in? If I have the same interests as this person, then I'll fit in. If I look like this person, then I might be involved in that group. How can I try and understand the jokes that I'm not quite getting?
Yeah. And I came to your training, which was incredible. And there was another word you used, which I'm trying to remember, but it was about copying. What?
So sort of camouflaging or masking.
Yeah, but what was the word we used? It begins with E. It was like echoing, echokinesis, echo something. Have I made that up? It was about being able to fit in, so they would sort of copy. They would try and sort of like mirror.
Mirroring, mimicking, camouflaging.
Yes.
Yeah. So there's a lot of evidence, actually, sort of talking to particularly females.
Right, okay.
Autistic females, where they've all reported that they would mimic other people.
Right, okay.
To try and fit in.
Yeah.
If they do what they do, then they might then they might sort of find things easier. There's sort of a masking of their autisticness, I suppose, whether they know that they're doing that or not.
Yeah.
So it might be, if they want to do stimming behaviours, sort of suppressing that and not allowing that out. It might be not talking about their passions, try not to sort of use the words like special interests, but actually we all have passions. And for autistic people, their passions are really important to them. So it might be that they sort of, dial that down a little bit and don't talk about them so much.
Right, okay. And I think where I went with that is the loss of identity.
Huge, yes. I think a lot of the work I do with my autistic clients in therapy is around identity.
Yeah.
Who am I? I've spent so many years trying to fit in.
Yeah.
I had a client who described it so well. They said, it's like I'm a chameleon against lots of different backgrounds all the time.
Oh, wow.
And it's exhausting. They've grown up just having to fit in, having to be the same as each background, as each environment that they were in. and that's how their identity formed,
Right.
being what they needed to be.
Yeah. Yeah.
So we might look at, okay, how can we help you be more your authentic self?
Yeah.
How can we help you engage more in your passions and kind of be open about that? How can we help you sort of not need to mask so much?
Yeah. Yeah. And have that ability, I guess, to go, this is my passion. This is what I want. This is what I like.
Absolutely.
Yeah.
Absolutely.
Yeah.
Yeah. And I've sort of found that a lot of people actually like to describe their identity in terms of what they like, what they do and what they like. So it's quite tangible.
Yes.
And it is so important to them. And those more kind of abstract qualities that we might use to describe ourselves, like, oh, I'm pragmatic, or I'm philosophical, or I'm or I'm funny. They're a bit harder to grasp,
right?
But actually, people sort of knowing what they like to do is really, really important. So I tend to start there with people.
Right, it's like an anchor, isn't it?
It really is. Yeah. And then that helps them kind of tune in really nicely to other people.
Yeah.
I've got this passion and you might have this passion.
Yeah.
We can connect around that passion, and that's brilliant.
Yeah.
So that's a really, really big part of therapy, is around identity.
I just sit in awe of you doing the work that you do and the way that you do it. When you're talking, there is such a love for the way that you work and the amount of effort that you put into being in this space for the people that you're working with. It's amazing.
It's something that I do feel really passionately about, and I feel really privileged to be able to sit with somebody and to help them understand themselves. It's just lovely because I also do private assessments as well.
Right, okay.
And so as part of that, afterwards, it's just wonderful being able to help somebody and be alongside somebody in going, right, so what does this mean for me?
Right.
And there's these moments of that makes sense.
Yeah.
I get it now. I get me now. And just watching somebody just look upon themselves with more kindness and compassion and go, oh, I can do this. I just do things in a different way.
Yeah. Well, it's a cliche, isn't it? But it sounds like a jigsaw puzzle being put back together or together.
I think it's just being able to kind of make sense of those elements of themselves.
Yeah.
As we all do, really.
And if somebody came to you for an assessment, what would that look like? What do they need to bring, and what do you give them?
So first of all, they don't need to bring anything, just themselves.
Yeah, good. That's a good start.
So they don't need to prepare anything. Just bring themselves along. So I always start by asking somebody, what brings you here for an assessment? What does it mean for you?
Yeah.
And that can mean so many different things. So it could mean, I just have always thought there's something different in the way that I experience the world. And luckily, there's more in the media now. So there's more good stuff in the media.
Yeah.
And so people might have seen a documentary, and they've gone, oh, that's me. Or they might have said, my child has just received a diagnosis. And when they were going through the assessment, I thought, oh, that's me.
Oh, wow.
That happens quite a lot as well.
Right, okay.
It might be that they're having difficulties at work.
Yeah.
Or in their relationship. So there might be lots of different reasons why people come along for an assessment.
It sounds like a surprise, but they sort of know it a little bit already. Yeah.
Absolutely. Yes. I'd say the majority of people go, I do think I'm autistic, and this is why.
Right, okay.
But it's so important to a lot of people to get that letter.
Yeah.
Self-diagnosis, I think, is incredibly valid. But for a lot of people, really tangibly getting that proof, that kind of diagnosis letter, because then they can go, right, it's real.
Yes,
I can trust it now.
Yeah. And I'm guessing you give tools to be able to, when the letter comes through, you can then maybe say to them, now you know, what do you need?
What do you need?
Yeah.
So as part of the process, we'll sort of explore lots of different things. So there's a sort of a developmental history discussion. You know, what was it like when you were growing up? What was it like at school? What was it like at work?
Yeah.
Tell me about your friendships, your relationships, what you like doing.
Yeah.
So all of that will have kind of come up
Yeah.
as part of that. And there's also some other sort of standardised assessments that we do alongside that.
Right. Yeah.
And I do sensory processing assessments as part of that as well.
Yeah.
So quite often these things will have come up a lot through the assessment,
Right.
where people might have shared, you know, difficulties, you know, maybe at school or in relationships or friendships and things like that. So when they get that diagnosis, that sort of letter, if you like, and report, we can then go, right, okay, so what does this mean? You know, you spoke about this challenge that you've had, or when this can feel difficult.
Yeah.
Or even how you're really good in this type of setting or environment, or how you love all of this stuff. And isn't that wonderful?
Yeah.
Let's understand that a little bit more.
Right. So the joy is the stuff that you can pinpoint and know, and then it's the other stuff that comes after that. And there's something, I don't know whether I'm not au fait with assessments online, but if you did an assessment online and you got a diagnosis back, or I'm not sure it would be a diagnosis online, I'm not 100% sure how it would be given, but there wouldn't be any aftercare. You'd get that information, yes you are or no you're not, but where's the aftercare?
Yeah. And what does it mean?
Yes.
You know, for some people it's enough where they go, I can believe it now.
Right, okay.
And it's kind of put something to bed for them.
Yeah.
But absolutely, I think you're absolutely right that there isn't the provision really in a lot of services for that aftercare.
Yeah. Yeah.
Or that sort of just post-diagnosis. What does this mean for you?
Yeah.
Because actually for some people it can be a difficult thing to hear.
Yeah.
You know, it's not always a positive. Some people it can be a difficult thing for them to
I think so.
adjust to.
Yeah. Yeah.
Because they might have had sort of an idea in their head of what it is to be autistic, and a few people have said, you know, over time to me, that means that I can't do anything about it.
Right.
If I'm autistic, it means that there's no treatment, if you like.
Yeah. Yeah. Yeah.
So it's really important to kind of work out with each individual, what does this mean for you?
Yeah, I think so, definitely.
You know,
yeah.
What does this mean for your relationship or for, you know, whatever?
Yeah, well, interactions with anything or anybody.
Yeah.
Absolutely. Yeah. Yeah.
Yeah. Yeah. So really, really important. And that's the bit that I love.
Yeah.
You know, that's the bit that I really, really enjoy.
I can tell.
Just helping people work themselves out. It's great. Yeah.
It's amazing what you do. It's been great to have you here, Karen. I do want to promote your course that you run, your workshop. I think it's amazing. And the feedback you got on your last one was incredible. As you know, even though you're not going to admit it, it was. I had somebody here today on another podcast who was still talking about it, which is incredible. So if there's anybody out there that wants to know about that,
absolutely,
please get in touch with POC, and then we can put the details and send them to you. I'm going to ask you to do some of it for my charity,
absolutely,
as well, which would be incredible, and teach the clinicians there to be able to recognise and sit with autistic people.
Because what I'm really keen for people to kind of come away with is the sense that I can sit with an autistic person.
Yeah.
It's a difference that we can sort of understand.
Yeah, absolutely.
And you know, you don't need anything special necessarily to be able to sit with another human who just processes things in a different way.
Absolutely. Yeah. It's been brilliant. Thank you so much.
Anything,
you're welcome. Anything you want to say before we finish? How has this been for you?
Yeah, it's been lovely actually being able to talk about it, because it is my thing.
Yeah,
and I love it. So it's really lovely having the opportunity to come here and be able to share it with you.
And that really comes across, your passion and your love for it. So it's lovely to see. So thank you for sharing it with us.
Thank you very much for having me.
You're welcome.
Firstly, thank you to Karen for taking the time to join us today. Both Lottie and I learnt a lot about your valuable work, and it's left me with more questions than it has answers. It's also opened our eyes to the beauty and the diversity and the importance of trying to really understand autism from an autistic perspective. Karen's passion and commitment to her work is truly heartwarming, so be sure to keep an eye out for her workshops. Highly recommended. If today's episode resonated with you, please get in touch and follow the links in the description below, like and subscribe. We're here to connect you with the right resources and support. Until next time, take care. That was it. That was it. That was it.